The death toll continues to rise as a cholera epidemic sweeps across a number of West African countries. Aid agencies are scrambling to treat thousands of patients. Just what will it take to end the recurrence of cholera in Africa? And are governments doing enough to deal with it? This is Inside Story. Hello and welcome to the program. I'm Fuli Batibo. West Africa is facing its worst cholera outbreak in years. The waterborne disease is spreading through coastal slums with more than 20,000 cases this year. Guinea and Ghana are among the affected countries where up to 300 people have died. In Guinea, cholera has infected more than 2,700 people. 5,600 more are infected in Ghana. But the worst affected is Sierra Leone. UNICEF says there are more than 11,000 cases, most of them in the capital city, Freetown. Now, the government there has declared the cholera outbreak a national emergency, and aid workers on the ground fear the worst is yet to come. We'll talk to Sierra Leone's health minister in a moment, but first, this report.
Medical staff in Sierra Leone's capital, Freetown, are treating new cholera patients in makeshift tarpaulin camps. The hospital has simply run out of space. With almost 12,000 cases of cholera now reported across the country, volunteers say they're struggling to cope.
There are many patients. We are not the only ones treating patients here. We have the Ministry of Health and other actors as well. We and the Ministry of Health and all the other actors are doing their very best, but I have to say that the needs are large, not just in Freetown, but outside of Freetown as well. And the needs are very big, and we do need more support.
Cholera causes acute diarrhea and vomiting and can kill within hours. People in Sierra Leone are trying desperately to fight the spread of infection.
The spray kills 99.8% of the bacteria, so any bacteria you bring from outside will die. They spray your shoes so that you don't spread the disease when you enter the camp.
In Sierra Leone, aid organisations say things have got much worse since the rainy season began in mid-July, and the number of people affected is likely to rise even further in the coming weeks. Joanna Blundell, Al Jazeera.
So, how to stop the cholera outbreak in Africa? To discuss this, we're joined by our guests in London. Huw Taylor, he's a professor of microbial ecology at the University of Brighton and a specialist of waterborne diseases. Also in London, Shuja Shafi, he's a specialist on health protection. On the line from Conakry in Guinea, Mouque, emergency field coordinator for Médecins Sans Frontières, Doctors Without Borders. He is managing a team of medics on the ground. And also on the line from Bene in northern Sierra Leone, Zainab Bangura. She is the health minister of Sierra Leone. Thank you all very much for speaking to us. Ms. Bangura in Sierra Leone, if I may begin with you, aid agencies are warning that the worst is yet to come in Sierra Leone. Please tell us about the situation in your country right now. How serious is this outbreak compared to previous years?
Actually, this is the worst incidence of cholera that we have ever had in the history of Sierra Leone. At the moment, as I'm speaking to you, the caseload within the last 24 hours is up to about 14,400, and the death fatality rate is 228. So it's the worst case, and we have it spread almost all over the country, with the exception of 3 districts. We are still waiting for evidence. In Kailaon, we do not have any evidence of cholera yet, but we're trying to find out. In Koinadugu and in Kono, we're still doing laboratory tests.
Ms. Bangura, why do you think...
medical districts in Sierra Leone, we have about 11.
So why do you think it's worse this time around? What do you think makes your country more vulnerable to the recurrence of these outbreaks?
Well, I think first and foremost, the rain came very extremely early. And secondly, they are extremely heavy. And I think it's also the aftermath of the war, because we have a congestion of population in certain specific area. We have seen a growth of slums, especially in the western area where we have about 27 slums. And in these areas, we have serious problems of sanitation and water management. So I think those are some of the problems why we really have serious cases of cholera.
So what is your government doing then to prevent the outbreak from spreading and prevent more deaths, basically? What are you doing right now?
At the moment, the government, together with its health development partners, have actually established emergency facility clinics together with international NGOs, and we've gone on a massive sensitization. We have actually brought on board all the Ministry of Energy and Water Resources, Ministry of Trade with regards to food handling, the city government, the Ministry of Finance, and we've had a meeting together, and with the president himself chaired the meeting. He's established a presidential task force. It's an emergency case, and he solicited funding. So we're actually working around the clock to be able to make sure we're able to manage. And for now, it seems that we are trying to get it under control.
You're working around the clock, you say, but what are you doing as far as prevention is concerned? The criticism often is that governments tend to clean up the cholera mess once it's in full swing rather than working on prevention. So what's being done to prevent these outbreaks from occurring in such a regular manner in Sierra Leone?
We've solicited support from the Department of International Development Cooperation. They are sending us a technical expert, and also the Marseille University in France, to be able to first and foremost understand why we have this massive outbreak, and then to be able to put modality in place so that we can prevent it. And to be able to do this, the president is looking at it on a developmental perspective. So it's not only an issue of health, it is an issue of saying that what do we do with regards to water management? What do we do with regards to food handling? So like I mentioned to you, a presidential task force has been put in place. And the task force is not only to make sure that the incidents we have are under control, but to be able to prevent further. This is the reason why we have asked for help. Like I mentioned to you, the Department of International Development in the UK is sending a technical expert, as well as the University of Marseille is sending somebody. And this people will be arriving very soon in Freetown to be able to work with us so that we can prevent the recurrence of the cholera incident in Sierra Leone.
And as you know, the UK government has pledged some $4.3 million to help fight this epidemic. It's basically money for anti-cholera. But ultimately, it's your government's responsibility to address the very basic sanitation rights of Sierra Leonean citizens. So how are we going to be sure that this money that's being pledged by different organizations and countries is being used efficiently on the ground and provide proper sanitation for your citizens?
As I said, we put together a presidential task force. The task force is working under the president's office. And within the task force, we've opened up a blanket funding arrangement so that whoever receives funding, the funding according to the announcement made to me as Minister of Health by the head of the DFID, that this money is going to go through NGOs. And these NGOs will be working based on the plans that we have in place. We're going to open additional centers, health facilities. We're going to give overtime resources to the health workers. We're going to bring in IVP fluid and drugs and other things. And even the Red Cross is bringing. So every mobilization, every support that is going to be brought within the country will be managed within the presidential platform that is dealing with the cholera. And we have a control command center that is being set up at the WHO office. And that also is going to be where we will be doing the epidemiology studies, where we're doing the case management, and where we're going to open the centers that will manage the cholera cases. So we try to centralize the management of this incident and work with district cholera committees at each of the 13 medical districts. And they will be reporting to the command and control center, which is stationed at the WHO office, and working closely and headed by the Minister of Health staff, by the Director of Prevention and Surveillance.
Okay, thank you very much for taking the time to talk to us, Zainab Bangura. That's Zainab Bangura, Sierra Leone's health minister, on the line there from Sierra Leone. Let's now bring in Huw Taylor. Huw, this is a disease, cholera, that's very much treatable, and yet cholera outbreaks occur regularly in this part of Africa, in West Africa, whether it's Guinea, Sierra Leone. Why do you think these countries are so vulnerable? The minister there mentioned, of course, civil and political conflict, but is it just the only factor, you think?
Well, you're right in that we've known the causative organism for cholera for over 100 years. It's Vibrio cholerae, and it's often waterborne and foodborne. But the problem is that it's a disease of poverty, frankly. Whenever you get overcrowding and unhygienic conditions, there's going to be the risk of cholera, and that's, I think, what we're seeing in Sierra Leone.
Is it just about sanitation conditions, you think, or are there other factors that contribute to the spread of the disease?
Well, I think we need to tackle any cholera outbreak in 3 different ways. We need prevention, preparedness, and a response. As a public health microbiologist, my interest is in prevention. And whatever we've learned in the last few years about perhaps the survival of the organism in coastal areas and the influence of climate change, we still have to go back to basic sanitation measures, what we call WASH, water, sanitation and hygiene. So we need a clean water supply, sanitation, education and good hygiene, which is very difficult to achieve in slum dwellings.
Okay. Daniel Mouque in Conakry, Guinea. This is being described as one of the worst regional outbreaks in years. Just paint us a picture of the situation in Guinea. Has the outbreak reached its peak there?
Good afternoon. Thanks for having us on Inside Story. Currently, Médecins Sans Frontières has been treating 2,700 patients in Conakry, densely populated urban setting with about 2 million inhabitants. Currently, we are looking at this epidemic becoming a national issue and a national emergency, basically.
Is the outbreak more severe in Conakry, in the capital? What do you know of the situation in the rural areas? I imagine it's more difficult to contain in the urban areas than in the rural areas.
The history of cholera in Guinea always affected to a large extent Conakry and the urban population. However, the outbreak started basically earlier this year in February on the coastal region of Guinea, where MSF, as a rapid response in prevention, conducted a vaccination campaign to contain the cholera outbreak. However, the center became, over the past month, Conakry, and from Conakry onwards, it's basically spreading to the interior of the country right now.
Okay. Shuja Shafi in London. After years of cyclical cholera outbreaks in West Africa, water and sanitation standards are still, very poor, still very notoriously low in many of these West African countries. Why do you think that is? And why is it that, given the cyclical nature of cholera, these governments aren't doing more at the prevention level?
Yeah, I think as has been discussed and as mentioned, it's a waterborne disease, it's a foodborne disease, it's contamination through these processes that produce the outbreak, and poor sanitation adds to the factor. Rain and excessive rain, again, actually adds to the factor. So what we have over the years, the conditions that are really rife, that facilitate the spread are there, and it is those conditions that need to be to be addressed, and that is really the root cause. We are talking about Sierra Leone and also of Guinea, but there are other parts of the other countries in West Africa that are also affected. This outbreak started. First initial cases were reported in January, and there's been a steady increase in these. the rainy season between May and October. So we've got a long spell still to go before the worst comes. So I think we've got to look at this in two sections. One is how to deal with the current emergency. Case management, as the minister said, and that is very important. Surveillance, actually finding out the extent of the problems. What we have now is probably an underestimate, because if you look very carefully, you'll unearth more cases. And a proper surveillance program is absolutely necessary so that one understands the scale of the problem. And typically, this is what is happening, then if you improve your surveillance, then the number of cases would increase. And that, to a certain extent, is a good indicator that you're actually searching hard for the cases. Then the other is Sorry.
Yes, I just want to bring in, you spoke of surveillance there, and I want to ask Daniel Mouque in Conakry whether the government in Guinea was quick to raise the alarm bells as far as this current epidemic is concerned, because there have been accusations that the government may have tried to hide the extent of the outbreak. What did you notice on the ground?
The authorities in Guinea responded very, very swiftly on the first cases and declared a state of emergency there, as much as the authorities in Sierra Leone did, as far as I know. So the response has been there. Nevertheless, in the national contingency plan, there's a clear role for Médecins Sans Frontières to be at the core of case management and patient treatment. But this is basically the focus of our operations and emergency intervention in Guinea.
But some aid agencies, Daniel, have said that there's been a failure, perhaps, to take cholera seriously by these governments, and a failure to publicize. Did you notice that in Guinea? Do people talk about cholera? Is this widely spoken of?
Cholera is a reality for the most vulnerable population in Guinea, in Conakry. So there is a certain awareness about it. Nevertheless, the cases or the patients we see arriving to our treatment facilities are in very, very bad shape, and they're basically arriving way too late. So on the prevention or sensibilization issue, I think more efforts would definitely help us to manage this outbreak. Nevertheless, it has to be said, this outbreak is compared to 2007 one. We are at double the numbers of patients and affected population right now than we were in 2007. So I think it is very, very difficult to project where all this epidemic is going in the weeks coming.
Huw Taylor, in London, there are several vaccines available to prevent cholera. Why do you think there hasn't been a massive vaccination campaign, as is the case for polio, for instance, in these regions that are so vulnerable to the disease?
I think in any disease that causes panic, such as cholera, there's the usual response to think about vaccination as a sort of magic bullet. And it does have its place in a response to an epidemic. But it's difficult to enact. There's still research needed on the vaccines. And I would say that more focus perhaps needs to be put into prevention rather than resolving the problem through vaccination.
Shuja Shafi in London, do you agree with that? Do you think vaccination is difficult to enact?
It's difficult to enact, and any amount of vaccination is not going to remove the threat of spread, because unless you have the infrastructure. Now, we know that, less than half or less than 40% of the population has access to private or shared toilet facilities. Now, that's how it spreads. It spreads through fecal contamination, and if that is taking place, defecation is taking place near water wells, open wells, then you have a perfect recipe. And any amount of of vaccination, immunization is not going to help, because there is this continuum of method of spread. And I think that is what is most important.
Daniel, in Guinea, you told us that Médecins Sans Frontières has been using a vaccine in Guinea against cholera. How effective has this been? And is this a long-term solution, and could people afford it?
It is oral vaccine administered in 2 doses. The effectiveness of this vaccination campaign, as we can see, is a coverage of 61% so far. Médecins Sans Frontières earlier month this year vaccinated 140,000 people in the coastal region of Guinea. It is a vaccination which should give you coverage, as I said earlier, of 61% for about 3 years' time.
So do you think these countries, Guinea, Sierra Leone, who are, facing certain difficulties when it comes to daily life and so on, can they eventually, afford this vaccine? Can this be a solution for them?
Vaccination is for Médecins Sans Frontières, certainly in Guinea, a pilot project to see what kind of impact on the prevention axis we can achieve with this. From our side, as said earlier, the focus is on case management, but obviously any kind of cholera we can prevent is easier for case management. So I think it is certainly worthwhile a shot. That yet on prevention, it is very difficult to measure the impact and the real effect all this has on an epidemic. On our side, we only can say it only can help. Huh?
All right, Huw Taylor in London, do you think a long-term resolution to this disease is elusive in these countries? And what do you think the structural issues are that need to be addressed?
Well, the main issues, as I've said, are providing clean water and adequate sanitation. Many people will have heard of the Millennium Development Goals and the target of reducing
which many
by
of these
half the number
African
of
countries,
people.
in fact, haven't met yet.
No, they haven't. And where they have met them, we have to remember that it's the water supply target was for improved water. I'm just back from Malawi, where I've been working with UNICEF, looking at rural water supplies. And we found many villages where they met the criteria of improved in that it was a protected well, but the bacterial contamination was much, much higher than we would expect in Europe. So we shouldn't think that the Millennium Development Goals have solved the problem. There's an awful lot more work to do.
All right, Shuja Shafi in London, you've worked as a health protection specialist. What do you think needs to be done to eradicate cholera in these African countries? And is the money there, you think, or does more money need to be pledged to these countries?
Well, money is never sufficient for anything. What we really need to do is to focus on the key measures. We've talked so far about the management of acute cases. What we also need to do is to develop a proper infrastructure, toilet facilities. I think it is extremely important that the source, the mechanism through which this spreads is properly secured, and that is what needs to be looked at. And any governmental or any sort of aid should concentrate on making sure that that infrastructure is developed and is there, because not only you'll be talking about cholera now, but there are a number of other conditions that could spread through this source, and by actually addressing this issue you could you could protect a number of other diseases, typhoid and polio. You mentioned, yes, polio has been eradicated or nearly eradicated, but there are a number of other conditions that could actually be prevented by and controlled by proper sanitation, proper food practices, and educating the community.
I'll ask Daniel in Guinea the last question here. Of course, this is being described as the worst outbreak in years. How do you assess the current situation? How bad do you think it's going to get? And do you think a long-term solution is elusive, as some have suggested?
I think it's a definition of long-term for us as a medical emergency intervention organization. for us is like containing the negative impact of any kind of epidemic. So we're certainly looking at longer, for the coming months, engagement of Médecins Sans Frontières in Guinea, especially on national level. That will be a serious challenge to our operations. Nevertheless, with an emergency team on ground, we will do our possibly best to contain this outbreak. And for the epidemiologic development, we really have to see what are we facing within the coming weeks.
Okay.
Currently, this week we had like 718 admissions only in Conakry. That is plus the national level, and we are prepared to have a closer look to the development nationwide.
Okay, thank you all very much for being on this edition of Inside Story. In London, Huw Taylor. Also in London, Shuja Shafi. On the line from Conakry in Guinea, Daniel Mouque. And we also heard from Sierra Leone's Health Minister, Zainab Bangura. And thank you also for joining us on this edition of Inside Story. As always, if you want to send us your feedback, email us your thoughts at insidestory@aljazeera.net. Thanks again for watching. Goodbye for now.